Well, you know, my story kind of starts with my daughter, Dion's. I have a very medically complex 10-year-old little girl. She was born with a rare genetic syndrome called JARC11. And so my story really starts with her. We had been going for about a year, seeing her primary care physician with some type of infection. And so we would get treatment and it would go a little bit dormant and then come back again. And so as time went on, like we go maybe a couple months, she'd be okay, and then something would come back and I'm like, she would have these symptoms again. And so I went back to her and we start the same regimen of treatment. And so this went on for about a year. And then towards the end of the year, I said, you know what, something is definitely not right. We need to do something differently. And so by saying that, she said, okay, well, let's involve some other services. And so they put their heads together, which we should have done a whole lot earlier. And we did a bronchoscopy, and they went down and they looked and they took a sample from the lower lobes of the lungs, and it came back that she has an antibiotic resistant infection called Serratia. So it had been brewing for a long time, and the fact that it was there and we weren't properly treating it, it caused damage to her lungs. And for her, she's a trach and vent child. She has a tracheostomy and a ventilator. And so we don't have a lot of good healthy lungs as it is. So the lungs that we have, we really try to keep them healthy, and so it has caused damage that's irreversible. And so, you know, we just have to be empowered. We have to encourage our peers, other patients, to get involved and come to the table with us. You know, it's no more of this us on the table. We want to sit at the table with you and co-create programs and systems and processes.